So continuing on overview of bacteriology, the we classify them as cocci. There are 5 cocci which are important. Please come. Staphylococcus, Streptococci, pneumococci, meningococci, and gonococci. So repeat with me. There are 5 pathogenic cocci which cause infection in man. There are 5 cocci which cause infection in man. Staphylococci. Staphylococci is gram-positive cocci arranged in clusters. Why it is arranged in clusters? Why it is arranged in clusters? Because they divide whole like this. They divide in all planes. Daughter cells fail to separate out. They divide in all planes and daughter cells fail to separate out. Gram-positive cocci arranged in clusters. Okay, streptococci is chain. They look like bunch of grapes. Here they look like serpent. Pneumococci is plano-convex, 2 cocci enclosed in a single capsule. Meningococci is plano-convex, gonococci is kidney shaped. Gonococci is kidney shaped. So there are 5 cocci which cause infection in man: Staphylococci, Streptococci, Pneumococci, Gonococci, and Meningococci. Okay. Strepto and pneumo are gram positive. Staphylococci, Streptococci, pneumococci are gram positive. First 3 cocci are gram positive. First 3 cocci are gram positive, and these 3 are diplococci. They are seen in pairs. They are seen in pairs. So, staphylococci give rise to pyogenic infection as well as non-pyogenic infections such as toxic shock syndrome, food poisoning, and superficial skin scalded syndrome. Superficial skin scalded syndrome. Superficial skin scalded syndrome. So it's very important. Uh, Now moving on to the yesterday I told you about staphylococcus. It produces. You have to remember with 2 C's. 2 C's. One is catalase, another is coagulase. Catalase, it splits the hydrogen peroxide into water and oxygen. It splits the hydrogen peroxide into water and oxygen. When you pour hydrogen peroxide on the emulsions, a saline emulsion of staphylococcus, there will be bubbling due to the oxygen. Coagulase is there are 2 types of coagulase. So you put plasma and saline suspension of organism, the bacteria clump. Tube is they form coagulum at the bottom of tube. After you take broth culture, add 1 in 6 dilution of plasma. After 4 hours, there is a thick coagulum at the bottom of the tube. So coagulase converts fibrinogen into fibrin. Coagulase converts fibrinogen into fibrin, forms a barrier around the organism. Coagulase converts fibrinogen into fibrin, forms a barrier around our organism. So Staphylococci produces all localized lesions. Streptococci produces spreading lesion. Streptococci produces spreading lesion, because it produces an enzyme called hyaluronic acid. It produces an enzyme called hyaluronic acid, which splits the ground substance made up of hyaluronic acid, which splits the ground substance which is made up of hyaluronic acid. Now moving on to the classification of streptococci. Streptococci are broadly classified into aerobic streptococci and anaerobic streptococci. They are classified into aerobic streptococci, anaerobic streptococci. Aerobic, they grow in the presence of oxygen. Anaerobic, they grow in the absence of oxygen. Example of anaerobic streptococci is peptostreptococci. Streptococci, it's a normal inhabitant of the female genital tract, one of the important organisms which causes neonatal sepsis. Neonatal sepsis. Immediately after delivery, it is important organism which causes neonatal sepsis. Important organism. Now, aerobic streptococci are classified into three groups: alpha hemolytic streptococci, beta hemolytic streptococci, and gamma hemolytic streptococci. Alpha hemolytic streptococci, beta hemolytic streptococci, gamma hemolytic streptococci. Alpha hemolysis, everybody, you have to tell with me. Alpha hemolysis is partial zone of hemolysis. Alpha hemolysis is partial zone of hemolysis. Alpha hemolysis is a partial zone of hemolysis. Alpha hemolysis is a partial zone of hemolysis. It produces greenish discoloration around the colonies. Alpha hemolysis produces greenish discoloration around the colonies. Example is Streptococcus viridans. Everybody, Streptococcus viridans. Streptococcus viridans. It's normally present in the oral mucous membrane, but post dental extraction, you do not cover with antibiotic. It gives rise to SBE. SBE stands for subacute bacterial endocarditis. Subacute bacterial endocarditis. Subacute bacterial endocarditis. Post dental extraction in previously damaged heart with rheumatic heart disease, it gives rise to subacute bacterial endocarditis. Subspecies Streptococcus mutans. Streptococcus mutans. Streptococcus mutans is normally present in the oral cavity. If you don't brush your teeth in the night to sleep, there is a lot of food particles into the dental crevices. All the organisms present in the oral cavity feed on them and produce enormous amount of lactic acid. They corrode and cause dental caries. Dental caries. All of you should today take a oath that before going to the bed, you have to brush and floss if possible and use a good mouthwash. So God given 32 are pearls. So don't go to the dentist and they do a lot of painful work in your oral cavity, and you get the dentists are really very bad. I mean, as far as sterility is concerned. Now, beta amyloid streptococci, by taking carbohydrate antigen, is called Lanfield classification. They are classified into A to W, except I and J. A to W. C antigen, it's called Rebecca-Lanfield classification. C antigen classified into A to W, except I and J. And the important one is Group A. Group A streptococci. Group A streptococci is nicknamed as flesh-eating bacteria. It is nicknamed as flesh-eating bacteria, and it licks the joint and bites the heart. Everybody, it licks the joint and bites the heart. It licks the joint and bites the heart. It licks the joint, bites the heart. It licks the joint and bites the heart. And very important, it gives rise to what is called as life-threatening. Sometimes people die of this necrotizing fasciitis. Necrotizing fasciitis. All the streptococcal lesions are spreading. All the streptococcal lesions are spreading. All the streptococcal lesions are spreading because it produces hyaluronic acid, which breaks the ground substance made up of hyaluronic acid. All the region, lymphangitis, lymphadenitis, impetigo, erysipelas, all these are pyogenic infection. But important, streptococci we are very important, we consider because it gives rise to what is called as post-streptococcal sequelae. Post-streptococcal infection. Post-streptococcal infection. There are, hold like this, there are, everybody say with me, there are two post-streptococcal infection which 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 follows acute streptococcal sore throat 3 weeks, 3 weeks in 3% of cases, and it gives rise to acute rheumatic fever. It gives rise to 3% of cases 3 weeks after acute sore throat, acute pharyngitis. It gives rise to pancarditis or rheumatic fever. Rheumatic fever. Rheumatic fever is diagnosed by Zones criteria. What is Zones criteria? You write like this. Zones criteria. It's diagnosed by Zones criteria. J for joint, rheumatic arthritis. Joint pain, rheumatic arthritis. Joints, it involves joints, gives rise to very speciality. Once you see a rheumatic fever case, you will not forget. It is a migratory, ankle, knee, hip, like that. It's a migratory arthritis. Very important. It is a migration, one from one joint to another joint. Migratory arthritis. It is called as migratory arthritis. Next is carditis. That's why I written like a heart. Okay. And subcutaneous nodules. Subcutaneous nodules. And the fourth one is erythema nodosum. This is to erythematous nodules, erythema nodosum. And last one is nervous system is it is called as Sydenham chorea. Jerky movement involves the skin just like the Sydenham chorea. So it's very important. You have to know zones criteria. It is often asked in your examination, especially in medicine, pediatrics and medicine. They ask you. Rheumatic carditis is very common in children. Now, the skin infection in 3%, 3 weeks after that, it involves to kidney. It's called ARF. ARF is acute rheumatic fever and acute glomerulonephritis. Acute glomerulonephritis. Acute glomerulonephritis. Acute glomerulonephritis. Acute glomerulonephritis. So, everybody repeat with me. Post-streptococcal sequelae usually follows in 3% of cases. For example, 3% means if 100 people are infected, 97% are fortunate, they don't get infected. Only 3 people out of 100 go in for complications like acute glomerulonephritis or acute rheumatic fever. Usually sore throat, streptococcal pharyngitis follows acute rheumatic fever, acute rheumatic fever. These are the arthritis, carditis, nodules, erythemas and nodules, syndrome, chorea. All these are major criteria. Minor criteria, CRP, ESR, all those leukocytosis and all those. One major, two minor, two major, one minor, like that. They'll teach you how to diagnose a case of rheumatic fever when you go to the ASLO titer. We'll tell you what is ASLO titer. ASLO titer is anti-streptolysin O titer. Anti-streptolysin O titer. ASLO titer is a latex agglutination test done for the diagnosis of rheumatic fever as well as glomerular. It suggests that the person has been infected by streptococcal lesion in the recent past. Streptococcal lesion in the recent past. Streptococcal lesions in the recent past. Now everybody with me. Post-streptococcal sequelae are, so remember it as ARF and AGN. Post-streptococcal sequelae are acute rheumatic fever, acute glomerulonephritis. Usually sore throat follows rheumatic fever and skin infection is followed by glomerulonephritis. Why it happens? Because there is a molecular mimicry, antigenic sharing between heart wall and glomerular membrane, filtration membrane. With this is a type 3 hypersensitivity reaction. How do you classify hypersensitivity? Best mnemonic for hypersensitivity reaction. Remember hypersensitivity reaction. Remember acid. Acid. Remember with mnemonic acid. The type 1 is type 1 is anaphylaxis. Opposite terminology of prophylaxis is anaphylaxis, and anaphylaxis and allergy. Type 1 reaction. It occurs within a minutes, within 24 hours. The second one is cytotoxic, cytolytic. Cytolytic, cytotoxic. Cytolytic and cytotoxic. The third one is immune complex. Third one is immune complex. Third one is immune complex. And fourth one is delayed hypersensitivity reaction, tuberculin type. Delayed hypersensitivity reaction. Remember with a mnemonic acid, anaphylaxis, allergy, cytolytic, cytotoxic, immune complex. It is a type 3 hypersensitivity reaction due to the deposition of antigen antibody complex on the heart valves and the glomerular filter membrane. It gives rise to acute rheumatic fever and acute glomerulonephritis. Acute rheumatic fever and acute glomerulonephritis. Acute rheumatic fever and acute glomerulonephritis. It's very important. It will be asked in your examination, oral examination, what are post-streptococcals? What are the non-pyogenic infection produced by staphylococci? 3. Toxic shock syndrome, food poisoning, and superficial skin scalded syndrome. Very important. Please remember, non-pyogenic infection caused by staphylococci are 3. Food poisoning, toxic shock syndrome, superficial skin scalded syndrome. So group A, remember erysipelas, impetigo, lymphangitis, lymphadenitis, and all pus, whatever lesions produced by staphylococci are produced by streptococci. The important in staphylococci is methicillin resistant staphylococcus aureus. Only treatment for MRSA is linezolid or vancomycin. MRSA. Here it is sensitive to penicillin, but it gives rise to, due to molecular mimicry or antigenic sharing between heart wall and glomerular filter membrane, antigen antibodies get deposited. It gives rise to acute rheumatic fever and acute glomerulonephritis. Acute rheumatic fever and acute glomerulonephritis. This is a molecular mimicry, or it occurs in 3% of cases and 3 weeks after the acute infection. 3% of cases, 3 weeks after the acute infection. And now coming to the group B, it is called Streptococcus agalactiae. Streptococcus agalactiae. It's one of the important organism which causes neonatal meningitis. Like TA, it causes neonatal meningitis. Causes. Now coming to the gamma hemolytic streptococci. Gamma hemolytic means non-hemolytic. Non-hemolytic. It does not show any hemolysis on the blood agar. Example of non-hemolytic streptococci is enterococci. Enterococci. The example of enterococci are Streptococcus faecalis or Streptococcus faecium. Streptococcus faecalis or Streptococcus faecium. Streptococcus faecalis and Streptococcus faecium. They are normal inhabitant of the intestine. They are the normal inhabitant of the intestine. But when they get into the urinary tract, and urinary tract infection is common in female compared to male because of proximity of urethra and the proximity of urethra and short stature of urethra. So urinary tract infection is very common in female compared to the male. Enterococci is one of the important organisms that causes urinary tract infection. It causes urinary tract infection. So very important. These are the important organisms. You should not forget the alpha streptococcus. Everybody alpha Streptococcus viridans. Beta is classified by Rebecca Lansfield by taking carbohydrate antigen on the surface of the cell wall of the streptococci into A to W except I and J. Except probably she was not fond of I and J. She did not name after I and J. So group B streptococci is also called as gas. Group A streptococci. It's also called as gas. Group A streptococci is also called as gas. Group A streptococci is also called as gas. It's one of the important organisms which produces most of the pyogenic lesions. All are very spreading lesions, and it also causes necrotizing fasciitis. Necrotizing, that's why it eats the flesh, and sometimes you have to do rigorous treatment for this. Some people die of necrotizing fasciitis also. Non-pyogenic infection is gives rise to 3 weeks in 3% of cases. After 3% of cases, 3 weeks, it gives rise to acute rheumatic fever, Zones criteria, joint pain, uh, subcutaneous nodules, erythema nodosum, and Sydenham chorea. Sydenham chorea. And following the throat infection, it gives rise to acute glomerulonephritis. Skin infection, acute glomerulonephritis, and sore throat is followed by acute rheumatic fever. Drug of choice still remains the treatment. The diagnosis, the drug antibiotic which is usually administered is penicillin, penicillin, and penicillin. Still no streptococci has become resistant to penicillin. No organism has become resistant to penicillin. This much you remember today, and tomorrow, no tomorrow, no. Tuesday. Okay. Come to the class. We continue. Okay. From here onwards, if you miss a class, you will be suspended for 1 month. If any of you, one of you, if you are going, any problem is there, you take permission and go.